today's lecture is going to be on natural healing. But when I was writing the lecture, I really thought about it. I'm like, natural healing, what does that really mean? And then I thought, well, I'm going to be talking to a lot of women, right, who probably have major burnout in their adrenal glands, right? Yeah. So I turned my natural healing lecture more towards discussing different levels of stress and how that level of stress affects us physiologically. What do you think about that? Perfect. I think all of us need that, really. So my name is Dr. Shiva Lalazar, and I am a functional medicine doctor and specialist. I also am an anti-aging specialist, and I've been trained in IV chelation therapy. I've been practicing for over 20 years. I have a practice in Los Angeles, Brentwood area. I have identical twins. One of them definitely wants to follow my path and hopefully come and take over the practice, but they're only 13. So I still have my hands full. So what is functional medicine, right? Functional medicine is getting to the root cause of the core clinical issue or imbalances that underlie a disease or a condition. It's looking beyond signs and symptoms. Because if you just look at these signs and symptoms, it's your body's way of screaming for help. So covering up the sign and symptoms doesn't necessarily get rid of the root cause of the problem. And in the previous lecture, I talked about how if this wall is broken and I keep patching it up and don't look at the foundation of the wall, the crack is going to come back. It doesn't matter how many times I patch it up. Or if you have a rug that's full of dust underneath it and you keep putting furniture on top of it, the dust is not going to go away. The dust is still there. So it's very important for you to actually peel the rug, get rid of the dust underneath it, and put furniture on top of it after you clean it up, right? Makes sense. Looking at environmental inputs such as nutrition, hormones, chemicals, metabolism, absorption, and digestion is extremely important when we do functional medicine. Looking at leaky gut, food sensitivity, candida overgrowth, toxicity, hormone imbalance, and neurotransmitter imbalance are just a few examples of what a functional medicine doctor will do to balance things out in your system. Now, the other issue that most of us are encountering is this chronic stress, right? We're on the go all the time, and chronic stress is going to cause disease. 75% of diseases prevalent in the Western society today are related to the stress mechanisms of the body. So today, we're going to go into the biochemical pathway and figure out how stress is going to affect our hormones and it's going to affect our physiology. Classic signs of stress or, not feeling well, basically, is waking up in the morning and not feeling refreshed, feeling unusually tired most of the time, needing coffee, soda, or sugary snacks to get going and keep going, right? Feel physically exhausted, but your mind continues to race, filled with anxiety. So we're going to talk about those stages of stress, actually. The feeling that you are aging too quickly. Classic signs of adrenal stress is poor digestion, struggling to lose weight in spite of dieting and exercising, because all that cortisol is being pumped and you're carrying that weight around the belly, the visceral fat. It makes it very difficult to lose weight. Aching muscles and joint pain or tension in your body, especially in the neck area. You feel stiff most of the time. Diminished sex drive. In the menopause lecture, which I'm repeating actually at lunchtime tomorrow, in the menopause lecture, we talked about how our adrenal glands, as well as our ovaries in women, are responsible to produce testosterone and DHEA and cortisol, right? So when you're stressed and your adrenals are stressed out, you're not going to produce enough testosterone. That's why libido and sex drive goes down. And you're like, don't touch me, right? Feeling dark or depressed or having trouble concentrating and focusing and remembering things, the lack of motivation to accomplish even small tasks. You just can't do it, right? The system is not cooperating. Getting sick more frequently and taking longer to recover, so lowered immune system actually. Dr. Cellier was a very interesting physician who actually figured out this mechanism of stress. So we have the hypothalamus, the hypoaxis, and the adrenal glands that are these little walnut-shaped glands right above the kidneys that produce cortisol, the very important hormone. And in women, it produces testosterone and DHEA as well, the male hormone. So he described the general adaptation syndrome. So he described this alarm stage, you see that? And then the resistance stage, and then the adaptive resistance. So there are 3 stages in the level of stress that we go through. The first stage is the Superman complex, where we go, and the adrenals are like, yes, let's do it. Produce cortisol, and we are in a state of panic, and we can't sleep at nighttime, right? And we have these panic attacks because we're producing so much cortisol. Then it's the resistance stage where you're sometimes cranky. You go up and down. You have good days, you have bad days. And then the last stage is down and out, which unfortunately, after residency, I reached that stage. I was down and out. I used to cry in between my patients. I only could work 2 days a week because I had done it. During those 3 years of residency, I destroyed my adrenal glands. Because at the time, there were no laws, right? So 120 hours a week. And every golden weekend that I had, which was 1 weekend per month, my OB patients would come and deliver. So I had to go back to the hospital. So I had no rest. Imagine 3 years of stress, right? Now, at least in California, there is a law that residents can only work 80 hours a week, which still is a lot, right? Being on call every 3 days. You can see the relationship of cortisol to pregnenolone to DHEA. You can see the stages of fatigue and how this cortisol level is declining. Do you see that? Stage 1, stage 2, stage 3, and then failure. My line was all the way down here throughout the day, but I recovered completely. I go from 6 a.m. till 10 at night, and I'm doing great. You know, I have the name of my practice, Health and Vitality. So, acute adrenal stress and adrenal fatigue. This is the first phase, remember, the Superman complex, where you produce a lot of cortisol. Then you have mild adrenal fatigue, then you have high adrenal fatigue. Now, here is the little walnut-shaped gland that sits right above the adrenal glands. I think I have a picture of that. You see that? These are the kidneys, and these are the adrenal glands that are walnut-shaped, right? And they produce cortisol, and DHEA, and testosterone, and epinephrine, and norepinephrine. So if you're feeling depressed, it's because the adrenals are saying, I'm sorry, I can't do this anymore. I can't produce the feel-good hormones anymore. So it doesn't matter how much antidepressant you take, your adrenals are not functioning well, right? You need to rebuild the adrenal. You can see this, and we have a saliva test that I can ship to your home where you collect your saliva in the morning, at noon, in the afternoon, like 3 to 5 p.m., and at nighttime. And we're going to see exactly your cortisol pattern.